incoming travelers. More things are opening up. Many people are still dealing with the long-term symptoms of COVID-19. Dr. Julia Moore-Vogel from Scripps joining us with more. Doctor, good morning. Thank you for your time.
Good morning. Thanks for having me.
I know quite a few people who've gotten COVID-19 over the past few years, and there are some who are dealing with the long-term effects of it. How many here in San Diego are you seeing that just are carrying it still around?
Yeah, so the CDC released data last week saying that about 1 in 13 U.S. adults have long COVID, and that includes about 150,000 people in San Diego County based on the case counts that we have reported.
Are these mostly adults or children, doctor, who have these long-term symptoms?
It's kind of a misconception, but children can actually get it too. There's not as much data on children because it's a little bit more difficult to study them, but some studies say actually 25% of children have ongoing symptoms as well. It's also difficult, especially with young children, for them to report symptoms like fatigue or headache. It often comes out as emotional, symptoms that you're just trying to figure out why your child is so cranky and that sort of thing.
Is being cranky one of those symptoms? What exactly, like if you had COVID in the past few years, how would you know that you have the long-term symptoms that are still sticking around?
Yeah, so it's very diffuse. There are over 200 symptoms that are reported to be associated with it because it affects so many different organ systems. So some of the most common ones are fatigue, cognitive difficulties, like difficulty remembering things, headaches. A lot of people have heart rates and blood pressure that will shoot up as soon as they stand up, food intolerances, even chest pain, difficulty breathing, swelling. There are so many different things. But basically what you can say is, okay, since I had a COVID-19 infection, I have these ongoing things that I didn't have before the infection, you can pretty well guess it's long COVID.
Doctor, but also health issues come up over time as one gets older. Some things will happen that you didn't have before. So how do you know that it came from COVID-19?
Yeah, so I would hypothesize based on the time. If it happened, right after your infection, then you can definitely hypothesize. But it's important to talk to your doctor about it. Of course, you don't know for sure. Either way, the other challenge is there aren't good diagnostics right now for for long COVID. We really need more work in that area to help people understand what's going on in their bodies and what can they do about it. There are actually very few treatments, and a very large percentage of people with long COVID are so debilitated they're unable to work. About 22% of folks with long COVID are unable to work. And so it's an area that we really need to do more research into to help people that are suffering.
Did I hear you correctly that you said that there are not a lot of treatments available?
No, there's actually nothing that is well vetted and well validated for long COVID. We've been so focused on the acute phase, and we've made so much progress, right, with vaccines and antivirals and monoclonal antibodies. There's been so much progress in treating that, and that's great. And in my opinion, now it's time to turn our attention to all the folks who are left with these long-term ongoing symptoms to try to develop treatments there.
Are there groups of people, doctor, who would be more vulnerable to these long-term? Would it be the kids, the elderly?
Yeah, the most common age, it varies between studies, but what I would say is most common is sort of medium age, 30s to 50s is where we're seeing it really a lot. And actually women are much more susceptible than men are to getting it.
And from what I understand, I'm being told that fitness trackers can help. How so?
Yeah, so we are at Scripps Research working on a study that's based on what I learned the most helpful thing for me in treating my long COVID, in almost 2 years of having the disease. And so I've tried many different medications, many different supplements, but the thing that's been the most helpful is what I learned from other patients about managing my symptoms with a wrist-worn wearable device. So I wear it all the time. People always see me checking it. And so what it can do is help you learn about when you're overexerting yourself. the best treatment right now is actually to rest. And it's really hard to just stay in bed all day because you want to go about your life. But learning about when your body is getting to that point that you could end up exacerbating your symptoms and being forced to lay down and trying to rest before you are sort of stuck in bed for days is one of the most important things. So we call that pacing. Just like when you run a marathon, you want to pace yourself in mile 1 so that you don't gas out too early. It's the same idea, just to get through your daily life. And so using these wrist-worn wearable devices, we've seen in the patient community that it's been really helpful. So what we're doing at Scripps is launching a study to be able to give these wearable devices to people and have them report to us, does it really help them be able to manage their symptoms?
I love that. This very simple concept that many of us struggle with that could help with so many things, including long-term COVID. Rest. Rest. Yep. Doctor, thank you. Great advice.
Great to meet you. Thanks so much.